Welcome. Today we're exploring a complex neurodevelopmental disorder known as Smith-Magenis syndrome, or SMS. SMS impacts various aspects of an individual's life, from behavior and sleep patterns to physical characteristics. Understanding SMS is crucial for providing appropriate support and care to those affected. Smith-Magenis syndrome is primarily caused by a genetic abnormality. In most cases, it's due to a deletion of a small piece of chromosome 17, specifically in the region designated as 7p1.2. This deletion typically includes a critical gene called RI1. Less frequently, SMS can occur due to a mutation within the RI1 gene itself, even if the chromosomal region is intact. These genetic changes usually happen randomly during the formation of reproductive cells or in early embryonic development, meaning it's rarely inherited. The RI1 gene plays a vital role in regulating the expression of other genes involved in development. When RI1 is deleted or mutated, the production of its protein is disrupted, leading to widespread effects on various body systems. This disruption impacts neurological development, causing intellectual disability, behavioral problems, and sleep disturbances. It also affects physical development, leading to characteristic facial features and other physical anomalies. The specific mechanisms by which the RI1 protein influences these different systems are still being actively researched. Smith-Magenis syndrome is considered a rare disorder. It's estimated to affect approximately 1 in every 15,000 to 25,000 live births. However, because the symptoms can be varied and sometimes subtle, it's believed that SMS is likely underdiagnosed. It affects individuals of all ethnic backgrounds and geographical locations equally. The signs and symptoms of Smith-Magenis syndrome are diverse and can vary in severity from person to person. Common characteristics include mild to moderate intellectual disability, delayed speech and language skills, and distinctive facial features such as a broad, square face, deep-set eyes, a prominent jaw, and a flattened nasal bridge. Behavioral problems are often a hallmark of SMS, including attention deficits, hyperactivity, impulsivity, aggression, self-injurious behaviors such as head banging or skin picking, and an unusual fascination with objects. Sleep disturbances are also very common, characterized by an inverted circadian rhythm, meaning individuals are often excessively sleepy during the day and awake or restless at night. Other possible symptoms can include short stature, scoliosis, heart defects, kidney abnormalities, and hearing loss. Diagnosing Smith-Magenis syndrome typically involves a combination of clinical evaluation and genetic testing. Doctors may suspect SMS based on the presence of characteristic facial features, developmental delays, and behavioral issues. A definitive diagnosis is confirmed through genetic testing, such as chromosomal microarray analysis or FSH, to detect the deletion on chromosome 17 or through sequencing of the RA1 gene to identify any mutations. Early diagnosis is important as it allows for the implementation of appropriate interventions and support services. Smith-Magenis syndrome does not have subtypes as such. It is generally classified by the underlying genetic cause, primarily chromosome deletion or a pathogenic variant in the RAI1 gene. Research continues into variations in presentations given the genetic basis of the condition. Currently, there is no cure for Smith-Magenis syndrome. Treatment focuses on managing the various symptoms and improving the individual's quality of life. A multidisciplinary approach is essential, involving specialists such as pediatricians, geneticists, neurologists, psychiatrists, therapists, and educators. Behavioral therapies, including applied behavior analysis, (ABA), can help address behavioral problems. Medications may be used to manage specific symptoms like hyperactivity, anxiety, or sleep disturbances. Speech therapy and occupational therapy can support the development of communication and motor skills. Early intervention programs are crucial for maximizing developmental potential. As Smith-Magenis syndrome is typically caused by spontaneous genetic changes, there is currently no known way to prevent it. However, genetic counseling is recommended for families who have a child with SMS. This can help them understand the risk of recurrence in future pregnancies and explore available options for prenatal testing. The prognosis for individuals with Smith-Magenis syndrome varies depending on the severity of their symptoms and the effectiveness of interventions. While SMS is a lifelong condition, with appropriate support and management, individuals can achieve significant developmental progress and lead fulfilling lives. Ongoing research is focused on understanding the function of the RA1 gene, developing targeted therapies to address specific symptoms, and improving diagnostic methods. Studies are also exploring the potential of gene therapy to correct the underlying genetic defect. Recent research has focused on pharmacological treatments to regulate sleep patterns,